Good morning, Peter Goertz. I'm a psychiatrist. Psychosis can be so intense and extreme that it may feel to us like that could never happen to us, and it may make it easy for us to laugh or dismiss psychosis as something that is not within the realm of our potential experience. But the reality, in my opinion, is any of us, if we're stressed to an adequate degree, could well become psychotic. And psychosis in general is quite common. So what happened this past week is I saw a young patient, very young adult patient, barely in his 20s in the emergency room. And I was interviewing him. He seemed quite depressed, very constricted affect, and talked quite softly. And I was wondering, is this young gentleman psychotic or not? And then when I asked him about voices, he said, on and off, he's been hearing things very frequently for years. And I thought, wow, maybe he's psychotic. I spoke with both of his parents, and they both said they never heard him talk about anything in that realm, never heard him say he was hearing voices. He'd never appeared psychotic to them. And then I spent more time with the patient, and it turns out, finally, after talking with him at some length about the quote voices, it turns out he was meaning really that he was thinking things, he was having thoughts that seemed kind of like voices. So you have to really be careful. I feel like I almost diagnosed him as being psychotic, and that would have been a major mistake, and I'm sure I'm not the first one whom that's happened to, first psychiatrist. And I'm pretty sure many people have been placed on antipsychotic medicine without really needing the antipsychotic medicine. So you really have to be careful and try your best to discern what is actually happening. And that can take some time. And that in itself can be a challenge because you're often wanting to move on to the next person who's waiting to see you. There often are quite a few emergency room consults, and you don't want to take too long with one of them because then the other ones have to wait. So another thing that's important to do is communicate with the patient. So if someone has difficulty with English, you want to get an interpreter, and in the hospital I work in, it's quite easy to do. We just call the language line. And then I speak with the patient on the video monitor, and I speak with the interpreter on the phone, and the interpreter also has the patient on the line. So that works very well. A lot of the time, the patients I see in emergency rooms are via video. And another thing to realize is different cultures have different basic assumptions, and someone who says certain things in one culture may seem psychotic to someone else in a different culture. So you want to look at the cultural context also. You want to look at someone's spiritual beliefs. So all these things can play into what you end up diagnosing someone with, and you want to be very careful. Again, you don't want to label someone as psychotic if they're not psychotic. And basic things also to consider are medical issues, because if someone has, let's say, is elderly, has a urinary tract infection, is confused, delirious, and psychotic, you don't want to just look at the psychotic symptoms and ignore what's underneath them or underlying them. So you want to make sure you look at the whole picture and try and make sure you don't miss something medical that may be causing psychosis or even delirium with psychosis. Some medical issues can cause psychosis without necessarily causing delirium. And you want to get some lab work if at all possible, or especially if someone seems confused and in general. And you want to get a urine drug screen. Probably one of the most common reasons for psychosis in the patients I see is methamphetamine use. And these people can be psychotic for days after using, and maybe even longer, to a certain extent. Usually the psychosis wears off relatively quickly within a few days if someone's been using methamphetamine, but it can take a little time. And if someone has never been psychotic before, it's probably wise to get head imaging, so a non-contrast head CT, just to make sure there's nothing physical, no mass in the brain causing psychosis. And again, you don't want to ignore other things. So if someone's psychotic, and especially if they're elderly, you want to make sure you're not missing dementia also, because someone can be both psychotic and demented. Other things to look at that are easily confused with psychosis are, for instance, dissociation. So if someone has a history of severe abuse in childhood and having started dissociating in childhood and maybe still is dissociating, you want to be very careful, because they may even, for example, have dissociative identity disorder, what used to be called multiple personality disorder, and maybe hearing voices of other parts or other personalities, other parts of themselves, which is not psychotic, and they would not necessarily do well with an antipsychotic medication. So you want to be careful not to miss dissociation, and that can also take some time to discern. So bottom line, you do need to spend time with patients. And like I mentioned with the cultural aspect and the spiritual beliefs, you want to be careful with that, because someone can be experiencing spiritual events like hearing their deceased parents talk to them, which definitely may not be psychotic. So they may be spiritual experiences, what other people may call psychic experiences, that are not psychotic. So there are other realms aside from the logical world, and people may be in touch with them, and that does not mean that they're psychotic. So someone who's recently lost a family member and hears that deceased family member talking to them definitely does not necessarily show signs of psychosis by doing that. That can be very tricky on the other hand, though, because a lot of psychotic people tend to be very preoccupied with spiritual issues. So it can be quite confusing, but you want to, again, spend some time and try and discern that. Thank you.